Talk about swine flu. Is there an H1N1 imposter out there? It turns out that there may be. This is a new rhinovirus, which is basically the common cold that mirrors the symptoms of H1N1. And doctors have found out that hundreds of kids treated at Children's Hospital in Philadelphia had this rhinovirus, not H1N1. So now federal health investigators are looking to see if this is happening in other parts of the country as well. Joining us now is Dr. Jake Deutsch, a medical doctor at Hackensack University Medical Center. Doctor, thanks for being here.
Hi, how are you?
I'm well. Let's talk about what happened in Philadelphia. Hundreds of kids show up at Children's Hospital there thinking that they have swine flu. What were their symptoms?
A lot of the same symptoms, fevers, cough, body aches, but the thing that's usually particular to the rhinovirus is the runny nose, the upper respiratory secretions, and that's why it's called rhinovirus.
And by rhinovirus, you mean basically the common
cold. Yeah, this is not a new virus, but we had seen in this population a peak of children that presented with what we thought was influenza, which turned out to be the rhinovirus. So it was a little misleading in the diagnosis.
This must have been very confusing for doctors, and I'm wondering if it was confusing for the ultimate reporting of swine flu. Are the numbers escalating because of this strange common cold strain?
Well, this is only looking in Philadelphia, but we could extrapolate it to the country, and it most likely reflects some over-reporting of the incidence of the swine flu back in September. However, we are still seeing high peak numbers of swine flu and H1N1 in the hospitals now, and we're assuming anybody that comes in with a viral illness now is presenting with H1N1.
And in fact, you are an emergency room doctor.
Seeing lots of it.
Are you? Tell me what it's like when these doors slide open. How many swine flu cases are you seeing?
On an average day, we may be seeing 10 to 15, but I work in a hospital where there's 6 doctors that are on call at one time. It's difficult to put an actual number on it, but we're seeing about what's a little higher than average across the country, seeing about 22 million people that have been diagnosed with H1N1 and about 4,000 deaths. So that's a little bit higher than average. Lots of people coming in with fevers, body aches, typical flu symptoms.
And then how do you get to the bottom of what they really have?
We're just making a presumptive diagnosis based on their clinical presentation. So if you have the fever, the body aches, the cough, we assume that you have the swine flu. But it's really important to educate people. Covering your mouth, washing your hands, doing the things that you normally would for the flu is the best protection that we have.
But ultimately, you have a test, don't you, that can tell you whether or not somebody has the common cold or the swine flu, but I think it takes a while to get the results.
And we're not doing it routinely, so unless you're being admitted to the intensive care unit, unless you have serious illness, we're not making those tests available because it's going to just exhaust the resources for the hospitals.
All right, so for the parents listening out there this morning, how do they know how to interpret their child's fever today?
Well, I think that you have to assume that they have a viral illness and use your judgment like you would normally when they're sick. If they look more sick, if they have underlying medical problems, you need to call your pediatrician. I think this incidence with the rhinovirus is interesting because a lot of people who may now think that their kids are immune to H1N1 may not be choosing to get the vaccine, may be in fact candidates. So it's something to talk about with your pediatrician. Also, the Tamiflu, the antiviral agents, are not effective if this is rhinovirus. So you have to have good medical advice. Make sure you call your doctor before heading out to the hospital.
Oh man, and it's only going to get worse in the wintertime. Dr. Jake Deutsch, thanks so much for coming in to talk.